So is it time for a big fix? And just as urgently, will the new vaccine mandate for cross-border Canadian truckers that came into effect yesterday cause a massive supply chain shortage for consumers? To talk about that and lots more, we are now joined by the Minister of Intergovernmental Affairs, Dominic Leblanc. Minister, great to have you back on the program. Yesterday, your government slapped this new vaccine mandate on all Canadian truckers who are going across the border. They need now to be fully vaccinated. You know the concern about this. The Truckers Association has said this is going to pull 16,000 truckers, Canadian truckers, off the road. And this is going to lead to supply chain disruptions and higher prices. What is the plan to mitigate that?
So, Evan, this is not a surprise for the trucking industry. We had indicated that this would be the posture in the middle of January. We'd indicated that at the end of November, sort of 2.5 months ago. So they have known this is the case. The Americans are imposing next week a similar mandate. Evan, what's disrupting supply chains and what's endangering supply chains is COVID, is the pandemic. And the best way out of the pandemic is vaccination. So whether it's federally regulated workplaces where we've mandated vaccine requirements, or whether it's travel on an airplane, this shouldn't surprise anybody. Right. This, every doctor and public health expert will confirm, is the best way to get COVID behind us. And that's the best way to return security and stability to Canada's supply chain.
I understand that, but the reality is, I get it. And believe me, I appreciate the balance between pandemic and prices, but you still will have thousands and thousands of trucks off the road. You've still got people who are experiencing inflation at the grocery store. And I guess the question that your government might be asked is, look, given the reality, why impose it now? Why not keep these truckers as essential workers and give them an exemption until you can smooth this thing out?
Evan, as I said, everybody's had adequate notice that this policy was coming into effect. A similar policy is coming into effect in the United States. What will remove some of the inflationary pressures on supply chains? What will ensure that we have adequate and reliable supply at Canadian grocery stores is to bring an end to the pandemic, is to put COVID behind us. So the more people we can encourage to get vaccinated, to protect themselves, their families, and their communities, and the Canadian economy, the faster we can get COVID behind us.
Okay, so you got that situation that's unfolding, and I appreciate you're saying that the government needs to encourage people to get vaccinated. The Health Minister, Duclos, had floated the idea that provinces have to start talking about mandatory vaccinations. And then Quebec has this idea that they're going to have an anti-vax tax the unvaccinated. They call it a healthcare contribution. What's the federal government's position on the idea of that? Could that violate the Canada Health Act? Do you support this idea?
Well, we've taken note of a proposal that the Quebec government made public last week. Different provinces at different times, Evan, have put into place measures to encourage vaccine uptake. You'll remember when the vaccines first became available last spring and in great quantities last summer, some provinces had raffles for a lifetime hunting license to encourage people to get vaccinated. So across the country, different provincial governments within their own jurisdiction have been doing what they think is the best way to encourage their populations, their citizens, to get vaccinated. Our job as a national government is to ensure that we have an adequate supply of vaccines so that every eligible Canadian can receive one.
You can still have a position on this. Aaron O'Toole said he doesn't like this idea. Is it an incentive or is it punitive to target the unvaccinated and say you got to pay a price for this on our healthcare system? Is the federal government supportive of using the healthcare system to punish certain groups to change their behavior?
Evan, we don't know the details of this particular Quebec proposal. What we're supportive of is to use every available mechanism to encourage Canadians to get vaccinated, to do the right thing. In our own jurisdiction, Evan, whether it's federally regulated industries, banks, telecommunications companies, airlines, we've imposed vaccine mandates in the federal public service. So provinces are looking within their own jurisdiction at what they think is the best way to encourage vaccine uptake. And we'll continue to do what we can to ensure that provinces have an adequate supply of all of these vaccines and things like rapid tests and obviously new therapeutic drugs should they become available.
You were on the call with the Prime Minister and the Premiers, as you always are, and the Premiers always say, we need more money for healthcare. The truth is, yes, COVID has put gasoline on the fire, but the stats I quoted from the OECD, we are among the worst in the G20 and the G7 in terms of hospital beds per capita, 2.5 beds per 1,000. At what point does the federal government listen to the provinces and say, look, the system was overwhelmed before COVID? Did the Prime Minister or did you say, look, we are going to fix an already broken system and increase the transfer?
We've said, Evan, for many months, a First Minister's meeting the Prime Minister had a year ago, that we were prepared to increase the federal transfer for healthcare to provinces and territories. We're also in the middle of a very, very serious global pandemic. The Government of Canada has stepped up in a massive way to support provinces, the healthcare system, $65 billion alone during the pandemic to support healthcare delivery in the provinces. And what we've said, and the Prime Minister has had a number of conversations, for example, with Premier Horgan, who chairs the Council of the Federation, the group of premiers. We talked about it again last Monday evening. The Government of Canada will absolutely be there to increase support for public health care in Canada. But we've also said, Evan, that we want the appropriate data, we want the appropriate transparency as to how that money will improve outcomes for Canadians.
Okay, got to leave it there. Thanks for joining us this morning, Minister Leblanc.
Thanks, Evan. Have a great day.